Welcome, everyone. We are the Health Leadership and Learning Network here in the Faculty of Health at York University in Toronto, Ontario, Canada, for anyone who's joining us internationally. And we're here to talk today and fill you in on information and answer your questions regarding our Health Coach Professional Certificate. We have special guests joining us today, and we're running this webinar with the National Board for Health and Wellness Coaching, which provides an approved training program and certification. And joining me today on this webinar to co-host is my colleague Marianne Coe from the Health Leadership and Learning Network here in the Faculty of Health. Marianne is on the line with us. So let's start. Okay, our agenda for today. We have a lot to cover. There's a lot of information. If there's anything we're not able to get to, please know that we have a few plans to get you that additional information. And you could always send us an email and we could fill you in either talking to you directly on the phone. We're going to cover what is contained in our Health Coach Professional Certificate. And we're also going to cover how to become a National Board Certified Health and Wellness Coach. We have an additional special guest joining us today from the Ottawa Regional Cancer Foundation, because we wanted to give you the perspective of the employer and from the perspective of the clients or patients that are being served by health coaches here in Canada. So we have a special guest from the Ottawa Regional Cancer Foundation joining us. And Stephanie will be speaking at the end of this webinar. Let me tell you a little bit about the Health Leadership and Learning Network here in the Faculty of Health and why we are focusing on health coaching. And we've been running the program for almost a decade now. And as with the National Board, we've been working towards having some certification or a standard and certification for this program. We're really pleased that it does exist and that we've been able to achieve that. But for the Health Leadership and Learning Network, our focus is to offer learning, education, training to the health industry that may include social services staff in professional roles, as well as managers who may be overseeing healthcare. We focus on practical and applied university-based education with an evidence-based approach. Our instructors, our program directors are leading subject matter experts. Many of them also conduct research and publish and are well known in their areas of expertise. We focus on delivering this in small interactive groups with your professional peers. And in many of our programs, including Health Coach, it's an interprofessional group, which is something that we try and focus on, creating interprofessional learning environments. And we also do a lot of work with organizations here in Toronto and across Canada. Odette, I wonder if you could forward the slide. Thank you. So let's talk about the Health Coaching Professional Certificate. And I'm going to remind everyone that you may have questions as we go through this information. So please feel free to put them in the chat line. Odette is monitoring it. We're going to try and get to your questions. We don't get them again to them again specifically today. We will get to them post-webinar. The National Board is on the line. We have two representatives, Nicole Pope and Leanne Webster. And if there are any specific questions related to the National Board and the exam, they may be answering them directly in the chat line, if not later when they are specifically talking about the National Board. So let's proceed and tell you about the professional certificate. We've got the link to the program website there, and what I'm going to describe right now is on the website, so be assured of that. The program has been designed to address specific population needs at various stages of health, and the program includes prevention of disease states as well as supporting chronic disease states or when people are unwell and within the healthcare system receiving care. The program will equip you with skills to provide health coaching to your clients in a one-to-one practice-based situation or as an expansion of your role in team-based care, both within private practice and within organizations. You'll earn the Health Coaching Professional Certificate Digital Credential. Our programs are based on what we call micro-credentials, working towards a digital representation as a digital credential upon completion of the program. You have to complete all programs along the learning pathway to do this, including writing the exam, and you have to earn all skills of the digital credentials and pass an evaluative experiential learning module. So there is an evaluation piece to this program. Odette, if you could advance to the next slide. I'm going to throw this over to Marianne now, who has created our learning pathway, and she's going to tell you more about it.
Hi, so this is an infographic just representing our program as Tanya has described. I believe some or most of you would have already taken one or are thinking about taking one of our health coaching programs. So we have 2 4-day programs, first in lifestyle and wellness, and then it progresses on to the chronic disease management. Then we have a cultural safety program, and as Tanya described, we have an evaluation, which is our evaluative experiential learning module, which includes one-on-one simulated role-playing based on real-world cases, where you will need to pass this evaluation in order to earn your health coach professional certificate. As well, not shown here, we do also have 2 webinars, which is a legal and ethical issues for health coaches webinar and a starting your health and wellness business. And that second webinar is optional, but you would have to complete all the pieces in order to qualify for the board exam. And along the way, you can also earn individual digital credentials, which highlights specific skills, professional skills that are within each of these short courses. And these digital credentials are stackable, so you would earn them chronologically towards a professional certificate. So the Health Coach Professional Certificate, we have for the most part prepared it for or designed it for regulated healthcare professionals because it is still an unregulated field and since our program sort of goes into the chronic disease management space, we sort of believe that having a background and understanding of chronic conditions is important to take our health coaching program. It is, health and science evidence-based. However, I guess we do make some exceptions for non-regulated healthcare professionals who do meet a requirement of either a bachelor's degree in a health-related field, such as health promotion, public health, psychology, kinesiology, and have demonstrated knowledge of the pathway of diseases and an understanding of human anatomy or pathophysiology. And so this program is ideal, for people who are currently working in healthcare or an interprofessional care team that wants to expand it as part of their roles, like, for example, a dietitian in a family health team, or people who are interested in starting their own health coaching business.
Thank you, Marianne. We had a quick question in the chat line related to the digital credentials. I'll give that a quick explanation right now. The digital credential is something that's internal here to York University, and they're based on micro-credentials. Our programs are built on micro-credentials. The added benefit of having the digital credential itself is that you will have a digital badge and a badge wallet that you can share on your social media platforms, your LinkedIn profile. So it's a digitized way to share your learning, your achievement of this certificate. It could help you reach various audiences further and faster, as opposed to having a paper certificate. I see additional questions popping up. We hope to get to them.
Sorry. But yes,
pardon, Marianne?
There is a section on our website if you wanted to learn more about our digital credential initiative.
Excellent. Yes. Odette is on the line. I wonder, Odette, if you can post in the link to that webpage explaining our digital credentials, and she'll put that in the chat line. So for where, when, where, and how much, in terms of the program itself, the start dates, each program is offered several dates throughout the year by session. And then you have up to 2 years to complete the full professional certificate. Currently, it's online here in Ontario, Canada. The university is currently running all programs online. We offer it online in asynchronous and with asynchronous learning format. So there will be some on-demand pieces as well as live lectures online. The price is in Canadian dollars, and for the full suite of programs, it's a one-time upfront payment, $4,571 plus HST, which is Ontario-based. That's the highest savings option offered for the program. But if you were to purchase it, the tuition fees separately, they would be more individually priced, but you could contact us for more information. You can, if you opt in after completing the program, you can additionally purchase the remainder of the programs with a one-time balance payment. We've tried to make this as cost-effective as possible, so you are paying the lowest fee possible. Or you could pay as you go, and again, it's all in Canadian dollars. If we can advance to the next slide, Odette. And now we want to cover off some burning questions, and these are based on many questions that we get here in Health Leadership and Learning Network as people are calling us and emailing us. So Marianne's going to help us out with answering this question, and I'm going to start fielding them. So Marianne, can you help us understand, do people need to take the programs of the learning pathway and in any specific order, or can they just take them in whatever order they wish?
Well, so it's highly recommended that you would have taken the lifestyle and wellness program before taking the chronic disease management program, because a lot of the motivational interviewing and communication skills are covered in the lifestyle and wellness, and it's just briefly reviewed in the chronic disease management program before you sort of get into the deeper health coaching skills within the chronic disease space. So having motivational interviewing knowledge is a prerequisite before taking the chronic. However, the other pieces of it, the cultural safety, because that is sort of separate and before or in between the programs, but the lifestyle and wellness and chronic will have to be taken before you can write the individual assessment, the evaluative experiential learning module. And then you would have to complete everything before you earn the professional certificate.
Marianne, you kind of cut out there, I think, the technology and the Wi-Fi. If you could just mention again about taking cultural safety.
Right, yes. So cultural safety is the only piece that you can take sort of outside of the order because it's sort of adjacent to the core health coaching program. So you can take that before or in between or after. However, you just have to take it before you do the evaluative experiential learning module, because as mentioned, all these digital credentials are stackable and you need to have earned all of them before you can write the experiential evaluation, before you can earn the professional certificate.
Thanks, Marianne. Now, could a learner, take the program from any location?
Well, we've currently been able to transition the program into an online hybrid learning format. So the answer is yes. We will continue to offer this hybrid asynchronous and synchronous, but fully online format of the program onwards. And maybe, down the road, we will also offer it as a in-class program at our York University campus. But you will be able to continue to take the online program from any location. Thanks,
Marianne. I'm going to address the next question. How will the person, the individual, benefit from taking the health coach professional certificate? Well, overall, in terms of how it will benefit your client and patient, the evidence is there. I'm happy to share that with you. What I really want to talk about is the benefit to taking the program, because it aligns now with a standard that is evidence-based and that you can now take an exam. We don't have any regulation here in Canada over health coaching. From a perspective as a university and an educator, we always pursue what is the gold standard in absence of any regulation. And we're here to encourage our health professionals here in Canada who want to pursue health coaching to seek a program that is as close to a standard as possible in the absence of any regulation here in Canada. Outside of that position, there is so much evidence to support the use of health coaching around to support lifestyle and supporting population health goals through the use of health coaching as an intervention. Whether you're working upstream with people who want to stay well, or whether you're working downstream with people who are in the midst of chronic disease states and working with their caregivers as well to manage those complex chronic disease states, and using health coaching and those behavioral change approaches to support the care plan. Now, I know that we've got Stephanie on the line who will talk in a little bit more depth about what it means to a specific organization, and I think that will help answer this question as well. Our next question I'm going to field quickly to Marianne, because I want to make sure we get to the National Board. Why is it so important that the National Board of Health and Wellness Coaching approve our program?
So we actually did a lot of research when we were looking for an external accreditator or a program approver to sort of review and validate our health coaching program. And we found that the National Board's accreditation of program approval, mostly, university-based health coaching program, that they do use sort of a rigorous evidence-based approach in reviewing and validating programs. It was a very rigorous process to receive this approval, and that they map onto an industry standard that could be applied internationally. So we really wanted to differentiate ourselves with some of the programs, some of the sort of coaching programs such as life coaching or corporate coaching that maybe was not as much in sort of the health and science-based method of coaching. So that's sort of why we decided to go with the National Board.
Thanks, Marianne. In the interest of time, I'm just going to quickly get through the next questions. I want to make sure that everyone hears from the National Board. Is there a component that touches upon starting a business as a health coach? Yes, there is. We do run a small webinar, and you're welcome to contact us for a little bit more depth about that webinar and what it will cover. Will I finish with a credential? Will I be regulated and certified? When you finish the program, you receive the digital credentials, you receive a certificate of completion, but in order to be certified, you do need to write the exam with the National Board. And our next question is, I know someone who doesn't meet the current program requirements. Is there any advice for them? And I'm going to field that over to Marianne, who can help answer that question.
So for individuals who do not meet the program requirements, they are generally eligible to write the lifestyle and wellness health coaching program, if they have a diploma or college degree and some, experience or knowledge of the healthcare system. However, if they're really keen to do the professional certificate and, they're not a regulated healthcare professional, they don't have a relevant degree, and they don't have that prerequisite knowledge around pathophysiology or anatomy, that there are...
Looks like we've got some technology issues for Marianne.
If you can sort of acquire the program, for example, in pathophysiology or then, on a case-by-case basis, and especially if you have a lot of experience in healthcare, we can certainly consider it, but there will be a lot of prerequisite knowledge that you would have to show that you have acquired at a college or university level.
Thanks, Marianne. And if you're wondering for yourself, we address this on a case-by-case basis. So please contact the HLLN office, and our contact information will be at the end of this presentation. And now I'd like to advance to the next section of our webinar today. Odette, if you could advance the slides as well, and introduce the National Board who have kindly joined us here today. I'd like to welcome Leanne Webster, who's the Executive Director, and Nicole Pope, who's the Director of Operations, and throw it over to them to help answer some questions, again, that are the burning questions that have come to us, and we've assembled them, but also answer the questions coming through the chat as they see them and as they can. Welcome, Leanne, and welcome, Nicole.
Thank you.
Thank you so much for having us, Tanya.
You're very welcome. Thank you for being here.
Great. So, Leanne, do you want to start by maybe going over the history of the National Board a little bit?
Sure, that sounds perfect. Does that work for you, Tanya?
It does. It does. And then we will get to some questions.
Great.
Okay, sounds good. So the National Board for Health and Wellness Coaching started as a nonprofit entity in 2012. It was founded by two women who have been in the field for a very long time. One of them is Margaret Moore. She's the founder of Well Coaches. And the other is Dr. Karen Lawson, and she's out of the University of Minnesota. What happened was they were at the National Wellness Institute conference in Minnesota, and they started talking about the fact that the profession of health and wellness coaching was growing at a fairly rapid pace with absolutely no standards in place at all. And so they compared it to the Wild West and said, we really need to do something about this. And so that was really the beginning of the National Board for Health and Wellness Coaching. From there, they formalized and created a board of directors. And then the board of directors they were all subject matter experts who'd been practicing in the field for a very long time. And they did what's called a job task analysis. So when you develop a job task analysis for any profession, you're identifying the knowledge, tasks, and skills that somebody should have in order to perform that job well. And so they created 22 different knowledge, tasks, and skills for health and wellness coaching. This was done by a team of about 60 people. And then that was validated by approximately 1,000 people who said, yes, you're on the right track. So that's really key information for all of you to know, because all of our training and education standards are based off of that initial study that took place back in 2014. And so we created these training and education standards, and that's what programs have to adhere to when they apply to become approved by the National Board for Health and Wellness Coaching. So York had to go through a very extensive process in order to become approved by us. We are partnered with the National Board of Medical Examiners based here out of the US. They board certify physicians in the US and then actually do a lot internationally as well. We launched our first exam in September of 2017. And this exam results in the board certification credential. So it's a good way for people to distinguish themselves from other people who perhaps have not attended a training program at all. We now have a community of about 4,100 National Board Certified coaches. They represent every state here in America, but also 28 different countries. And we have quite a few people here in Canada as well. And we've got another 1,000 who just sat for our most recent exam. That exam window just closed a couple weeks ago, and they are waiting for their results. And we'll have about 5,000 people who are National Board Certified throughout the world by the end of this month when exam results are released. So that's a real general history of the organization. Nicole, do you have anything that you want to add to that?
I think that's excellent. I was just going to touch on the same thing about the that there are coaches in Canada that have sat for the exam. One of the questions in the box was if you had to travel to the US to sit for the exam, and you don't. It's proctored at Prometric testing centers, and there are centers in Canada, so you do not have to travel to the US to sit for this exam.
And I also want to add that the reason that I took this position in the first place, I've been with the National Board for Health and Wellness Coaching for 6 years. I took the position because as a practicing health and wellness coach, I saw that there was no standard in place whatsoever. And it was very frustrating to me. I actually went through the Well Coaches program in 2008. I'm a certified personal trainer too. And then I went through Real Balance in 2018. So I come to the table with a lot of practical knowledge about what it is and what it means to be a health and wellness coach, and how important it is to actually be able to say that there are training and education standards backing up your credential. So I just want to add that, and I'm happy to be a resource for you if you ever have any questions. So we'll hand it back to you, Tanya.
Thank you. Thank you both, Leanne and Nicole, for giving us an introduction to the background and the context for the National Board. Let's move on to some questions, and maybe we can get through many of them. I see that Nicole's been answering a number of them already in the chat line, which is great. And people keep adding your questions to the chat line, whether it be for Leanne or Nicole. So to start us off, I think this is a big burning question, Leanne, for many health coaches that I've heard in the past. How will the credential help me find work and clients?
Okay. So I think one of the things to really think about as a future health and wellness coach is, what does training and education mean? What's the value of certification, and why is it important? So anytime you're trying to integrate into healthcare, evidence matters, right? And so does training and education. So as I said earlier, this board certification is a result of a very formal process that we went through when we developed the job task analysis and then identified the competencies that are necessary for health and wellness coaching. So when you earn that credential, it really is speaking volumes to the fact that you have attended a program that meets training and education standards, and also that you've been assessed orally as a coach, right? So you've passed an oral exam as well. And that's incredibly important, especially when you're working with people. So this value becomes important if you're trying to get a job in healthcare or in employee wellness, or even with clients as an entrepreneur. It's really important that you're able to back up what you say you are as a professional, a health and wellness coach, with those standards. And I think it just makes a huge difference. One of the things that we're seeing a lot, not just in America, but really around the world, is employers reaching out to us who are asking us to share their job postings. And in many cases, those job postings are either requiring somebody who is National Board certified or somebody who meets the criteria and perhaps hasn't sat for the exam yet. So hopefully that answers it. If it wasn't a good enough answer, Tanya, just feel free to elaborate.
No, actually, Leanne, I think you covered it. 100% agree. And there's actually a follow-up question, which we have on the screen, and someone has asked that too in the chat line, is what is required to maintain the credential? And do you already have something in place or some guidelines that are in place?
Yeah. So Nicole, do you want to take that since you work with continuing education a lot?
Yep, of course. So once you get the credential of becoming a National Board Certified Health and Wellness Coach, recertification is every 3 years. You have to have 36 continuing education credits, and there's a fee of $150. And again, that's every 3 years. To get your continuing education credits, we have a long list of approved CE providers that you can go to get your courses. Some of them are free, some of them have charges. It's up to the provider whether or not they're charging for their CEs. And then the national board also offers a few a year. We do quarterly connects, which are really great sessions just like this, where we bring in experts in the field to talk on different topics and have questions with the national board certified coaches. And you can earn CEs for attending those as well. There's also a petition process if you need that, but that's how you would get those CEs. And then, like I said, it's every 3 years and $150 is the fee at this time.
Great. So Nicole, you're describing what I'm hearing as like a community of practice where you are continually able to upgrade your skills. And you could be doing that with fellow health coaches as well in an interprofessional way and an international way as well. So you've created this nice community.
Yep. To earn the CEs, it does need to be with an approved CE provider. So it would be, it wouldn't just be working like mentoring with coaches, although that is something that there are approved providers that do with that. But we definitely, outside of the CEs, we have a great community that are sharpening each other's skills all the time. That's a really important part of being a national board certified health and wellness coach. It's important to us, and it's also important to the people that have that credential to make sure they're staying up to date on the current what's happening right now in health and wellness and how they can help their clients. It's a continuous learning process when you're a national board certified coach. They take a lot of pride in that.
No, that too is very nice to hear. That is in line with with health professions here in Canada, the continual upgrading of skills, whether it's based on maintaining your license or not. It's a best practice. So again, it's a very welcome feature of working with the national board. And I would hope for anyone listening that you would see that too as a strength of having the certification through the national board. Now, after taking the certificate, this is another burning question which I've had asked of me for the last many years we've been offering this program. Can I open up my own practice as a health coach? Is that on the table?
So I can speak from here in the US, and then maybe you can add to that, Tanya. So in the United States, yes, you absolutely can open your own practice as an entrepreneur. Every state here in the US has different requirements in terms of just licensing, like town licenses that you get, business licenses that you get through your town or city. So I always encourage people, if you are located here in the US, to really look at your state and your county and your city's requirements. And then another question that often results from that is, do I need insurance? And here, at least in the US, I always encourage people to get a policy to protect themselves as health and wellness coaches. But yes, in fact, we have 4,100 national board certified coaches right now, and about 50% of them are entrepreneurs.
Okay, thank you, Leanne. I'm going to add some pieces in from Canada, but they resonate with exactly what you've just described.
Okay, great.
They really do. So in Canada, and I can see the chat line going with questions similar to this, if not directly this, to start off your own health coaching practice or put your sign up as a health coach. There's a purpose why we've predominantly been instructing healthcare professionals, licensed healthcare professionals, to be health coaches. Because within most scopes of practice, and please check yourself if you are, whether you're a nurse, occupational therapist, physical therapist, massage therapist, whatever profession you are, please make sure you check on this, that health coaching could be considered within your scope of practice, whether it be counseling or providing care around behavior change, or actually changing the care plan too, could be part of your health coaching role. And is that within your scope of practice? So if it's within your scope of practice, can you bill out on providing that care? Say if you're an occupational therapist or a physical therapist. If you're a nurse, perhaps you're providing that care as part of your current role within your a healthcare team in an organization that you're employed in. This piece, just as I'm describing it, just requires some independent research on your part, to everyone listening, to see how it would apply to you. And if you can charge, how you would offer this service of health coaching and how you would charge for it. Or if you wouldn't charge for it because you're doing it as part of your care team, say if you work at a hospital here in Canada. If you are functioning on your own and putting up your sign as a health coach, again, good to check on insurance through your current licensing body and make sure that that insurance covers you. Do some research. If you are not a licensed healthcare professional, you are best to investigate insurance, yes, before you begin to health coach. I remember discussing this many years ago as we started health coaching, and we had started off thinking of health coaching within clergy and other professional groups that sit outside of healthcare. And the thought still remains to this day that investigate insurance coverage for whatever you do that could impact a person's health. I'm going to go along now to another question. I'm sure there could be additional questions to this in the chat line. And Odette, feel free to field them as we're talking. Odette, is there anything you see in there that maybe is related to this question that you want fielded?
Yeah, no, we've been answering some of them. I think most of them are related to the insurance companies here in Canada. If they decide to open their own business, if they will be billable by Canadian insurance companies here. That's an interesting question from someone in the icon.
Well, again, I'm going to refer back to if you are a healthcare professional and if you do bill through these extended health benefits, like from Great West Life or Sun Life, you're best to investigate if health coaching is considered within your scope of practice and if it is billable. Perhaps talk to your college, talk to your colleagues, but definitely investigate it before you make that assumption. In Canada, I don't know if anyone's listening in from the United States or outside of Canada, our system is structured a little differently here. It is publicly funded, so we have to understand as healthcare providers how we would bill out that service, whether it would go through OHIP if we're working, say, within an organization like a hospital, providing that care through a care team, or if it would be going through an extended health benefits if we're seeing people in private practice. Okay.
And I just bring another question just to everyone's attention. Specifically, I think was for Canada, but I could be applied for any country. If you recommend to take the test after taking the program to open a business, is it necessary to take the test to open a business? I'm guessing the question came from Canada, but I'm guessing it could be anywhere.
Well, Leanne, can I start off and give an answer to that? Maybe throw that to you.
Mm-hmm.
From the perspective of our experience here in HLLN, working with health coaches, providing the program, my best advice is take the professional certificate in its entirety and write the licensing exam. And so that you can feel rest assured you've got all the knowledge you need to provide your practice in health coaching. And Leanne, do you have anything you would like to add to that?
Yeah, in the United States, health and wellness coaching is not regulated. However, we're making a very concerted effort to do a lot of outreach about the value of the board certification. And the hope is that things will shift over time to a point where the national board certification is an expectation when somebody is hiring a health and wellness coach. What we don't want is people to decide that they have a real passion for health and then deem themselves a health and wellness coach without any training or education, because in the long run, that's not best for the client. So we're trying to move in a direction where the board certification is the gold standard for the industry, and that's the expectation from consumers, employers, physicians, and those in healthcare.
Thank you, Leanne, for mentioning that the employer perspective on this as well. Or we completely agree, and we too here in Canada have been, in our own way, as educators, lobbying that employers focus in on making sure that health coaches they hire have a standard of practice, and it's based in evidence, and that the national board, being a national board certified health and wellness coach, should be a gold standard at this point for any healthcare organization hiring health coaches.
Yep. And you just triggered something in my memory. I just want to mention. There's a compendium of health and wellness coaching literature, because you keep referring to evidence. And I think that as a lot of people on this call will end up attending your program, and then they'll end up either becoming entrepreneurs or becoming employed. In some cases, they may be making the case for health and wellness coaching. So I just want to recommend that you people on this call Google the Compendium for Health and Wellness Coaching Literature. It's an amazing resource for you. It's got over 100 studies in there, all related to health and wellness coaching, and it's very easy to find if you just search Compendium for Health and Wellness Coaching Literature.
Thank you, Leanne. Thank you, and thank you for that compendium.
Yeah,
that's very helpful. We have a question in the chat line, and I wonder if the national board can comment on this. Is the success rates of writing the exam? Can you talk generally about the success rates?
Sure. So this is a fairly new exam in the world of exams, right? And so in the world of statistics and psychometricians, they like to see the exam being delivered dozens and dozens of times before there's actually a passing score. So right now, what I can say is this exam has been delivered 7 times, and between 78 to 82% of people who sat for the exam passed the exam. We have what's called a standard setting committee at this point. And so what happens is all the scores come in from an exam cohort. We'll say there's 1,000 scores. And then that standard setting committee takes a look at all the scores and all the test questions. And if there's a test question that, say 80% of people didn't get it right, the psychometrician is going to flag that question. And then the standard setting committee is going to take a look at it and say, hey, was there something going on here that perhaps didn't give the test taker the advantage, right? And so it's actually to the advantage right now that we have a standard setting, the advantage of the examinee that we have a standard setting committee in place to really take a deep look at the test while it's still essentially, been delivered 7 times. So that's where we're at. About 78 to 82% of people pass, and that's the information that we can provide.
Thanks, Leanne. So it sounds like there is some feedback post-exam, and can people rewrite the exam? Maybe I missed that.
Yep. Nicole?
I was answering a chat question in there. Yeah. Can you repeat that question for me?
Sure. So I can talk about it, but I thought you might want to, because this is more your area. If somebody doesn't pass the exam the first time, how many times can they retake the exam?
Great. Yes. So you get up to 3 attempts to pass the exam under the training that you have. So you complete this, the professional certificate, and you can sit 3 times if you were to fail those times. If you were to fail it 3 times, you would then be required to get additional training before you would be allowed to sit a 4th time for the exam. We have not had this happen yet, but that is the process that would happen if somebody failed 3 times. Also in that you do pay for the exam each time and apply each time. So it's not that if you sit for the exam and fail it, you get those 2 retakes automatically. You would have to reapply and pay the fees in order to sit a 2nd and a 3rd time.
Thank you. Thank you both, Nicole and Leanne, for explaining that. That can be really key, right? When you're writing a major exam, is being able to go back to it just in case you fail. Yes. are there any test prep courses to write the exam besides taking the certificate itself, like our certificate here at HLLN? Are there any other test prep courses that can be taken?
Yep, I'll take that one as well. So NBHWC offers a few documents and a small practice exam as test prep. However, there are a lot of prep courses popping up all over the place. If you Google anything about the board exam and test prep, there's all kinds of them popping up. NBHWC does not review any of them, so we really recommend that a person that's wanting to sit for the exam and take a test prep course really do some research on what they're using to create that test prep, and then how people who complete that program did. They probably have statistics on that kind of information. You just really want to do your research because we do not endorse or review any of those test prep courses.
Beautiful and very good point to make about the endorsement. But if you're writing such a major exam for yourself, it's good, everyone, to do your homework, get your ducks in a row of how you're going to prepare to write that exam. And if there are test preps available, perhaps investigate them for yourself to see what you feel would work best. Another question that is in our list, I just want to flip back to our list here. Can the person apply if they reside outside of North America? And I would think that this would be a very major question for you, that to provide opportunities for international people to write this exam. Could they write it if they're coming from outside of North America?
Yes. So we actually have board certified people in 28 different countries, and we approve programs throughout the world. There are Prometrics testing centers throughout the world. Now, the test is always delivered in English, but Nicole can work with people if they're coming from another country and they want to see if there's a test center near them. She can help them find, she'll give them the resource to find that Prometrics testing center wherever it is in the world.
Yeah. And that's easy to do. You actually just go to the Prometric Testing Center website, and there's a locate a center button. So you just click that and put in where you are, and it'll pop up a little map with where the centers are located near you.
Both. Thank you. That's good to hear. That's good to hear, because I'm anticipating that even for health coaching programs that have been board certified in the US, there could be interest internationally from people to attend those programs as well as the one here in Canada.
Mm-hmm. All the time. Yeah, all the time. In fact, there could be people from the US who want to attend your university.
Yep.
And then we have other training programs that have people literally from all over the world. So, and just to kind of give you an idea of how big it is, on Saturday, I'm actually talking to a symposium in Brazil. And there are several health and wellness coaches who are national board certified living in Brazil, who brought in all different healthcare providers to, create this symposium. We also have a bunch of health coaches in Colombia that I'm working with, in the UK. Switzerland is doing a lot. Asia. So lots of different countries are really aware. Oh, France just reached out to us. They're very aware of what's happening.
Excellent.
And that is really important. And I think that the pandemic worldwide has brought greater knowledge and people want to do something in terms of self-care, right? They want to take better care of themselves. So it's really leading to an increase in inquiries for us.
That's excellent. That's excellent for everyone.
Mm-hmm.
Obviously, that health coaching and its benefits is really spreading.
Yeah.
I realize we're at time, and I want to make sure that we get to our guest, our next really special guest. I just want to revisit something because my colleague Marianne Coe answered a question about insurance companies, and again, I just want to revisit this for the Canadian perspective on this. The question was, do many private insurance companies cover health and wellness services? I can't speak for our major health insurance companies here in Canada, like Great West Life and Sun Life. there is so much going on internally that they make their own decisions about what to cover. Your best to do as an independent health coach, do your homework, investigate it for your particular line of profession, whether you could be an occupational therapist, massage therapist, investigate it and see what the insurance industry would cover, perhaps under your own profession, if not outside of it. And do that investigation. Please do your due diligence. There are people around us here in Canada, including in the United States, like the National Board, that are being heard in terms of lobbying for health, for insurance companies to cover health coaching. So that is in the works, but are we there yet in Canada completely? From my personal perspective, not yet, but I hope we will be in the future. But again, please keep an eye on this for your own health coach coaching practice, and do your due diligence around this and understand what our health insurance industry is doing in relation to this. Leanne and Nicole, any last words or comments before we move on to our next section?
Oh, I'm just really thrilled that you had us.
I was hoping actually, sorry, just maybe quickly address the question of what sessions can I include on the coaching log, because there was a question about whether we would connect you to coaching sessions. And as of now, we do not offer sort of word placements. So maybe Leanne and Nicole can sort of respond to that question.
Yeah, so
go ahead, Leanne, you take it.
As a health coach and as somebody who had to get sessions early on in my career, that was before the board certification, but still was very relevant, and I did need to get 50 sessions. What I did was I reached out to family and friends, and I asked them to refer me to people I did not know. Within a day, I had more than enough people that I did not know to get those sessions in with. In terms of what we require, it's 50 sessions in duration of 20 minutes or more that cannot be with friends or family. And that's it. I mean, it's pretty.
Does it have to be paid sessions, or can it be sort of?
It can be either pro bono or paid. It can be either.
Okay, great.
Thank you, Leanne. And thank you, Marianne, for reminding me about that question. That's a good one, and a vital one. And now if we can turn to our guest speaker, I wonder if Odette, if you can change the slide. And thank you again, Leanne and Nicole, for talking to us today about the National Board of Health and Wellness Coaching. I just want to remind everyone that please reach out to us at HLLN. Our contact will be at the end of the session, again on the last slide, and I believe Odette has put it in the chat line. Reach out to us for any questions. I'm sure you can reach out to the National Board of Health and Wellness Coaching about the exam and ask them questions, maybe repeat these questions. Today, Leanne was telling me and Nicole, they're busy answering questions from another large session they ran, information session. So they're there to answer your questions to help facilitate you getting the information you need to write the exam and reduce the stress levels in terms of preparing for that exam as well. I'm really pleased to see how the National Board has provided supports in terms of prep and prep courses, or recommending that they be used, not any course in specifically, but it's a best practice, as well as ways to prepare if you fail the exam. And if you have any additional questions, I see Leanne has just posted any questions related to the exam. She's posted a contact, Christy Hunt, that can help you, and that is in the chat line right now. So I'm going to turn now to our guest from the Ottawa Regional Cancer Foundation. Stephanie Woodard is joining us today. And Stephanie's the Manager of Health Coaching and Strategy and Impact at the Ottawa Regional Cancer Foundation in Ottawa, Ontario, Canada. And this is a foundation that hires health coaches in the form of cancer coaching. And cancer coaching is, you could say, a subform of health coaching. And we've been really so pleased in the past to work with Ottawa Regional Cancer Foundation around building their cancer coaching program. And it's so lovely to see that this program of cancer coaching continues to blossom and grow. But I'm going to let Stephanie tell you more about that program. And welcome, Stephanie. Thank you for joining us today.
Oh, my pleasure. Thank you, Tanya, and thank you, everyone. What an amazing session it's been with questions flying. So, yeah, great introduction. Thank you. I guess you could laugh at us and say we're kind of doing things a little bit backwards, that we created this cancer coaching specialty and then recently have had two of our coaches move on to become board certified. So just to give you a very quick snapshot, we are a local charity here in Ottawa, fundraising to support local cancer research and clinical trials. But the new piece for us was, identifying a gap that people here in Ottawa felt that they weren't being looked at as a person experiencing cancer. So with that, we began to research what sort of impactful programs are out there and what should we be bringing to our families and our community. And of course, we landed on coaching. And just the fact that, it's so client-centered, it was about empowerment, self-management. It just was absolutely clear that was the answer of what we needed to be providing our families facing cancer. So following that, we sort of created our cancer coaching service as the synthesis of many of these sort of health coaching practices. Obviously, we focused very much on the different chronic diseases and how other countries were managing those with coaching. And we thought, well, let's deliver this service using regulated healthcare professionals. So our coaches right now do have backgrounds in nursing, social work are probably the two big ones. We certainly have had physiotherapists, dietitians, other professionals come on board over the years to work with us. And I think to your point today, why accreditation? So our two full-time coaches went through the integrative health coaching program at Duke University, and one went through the Mayo Clinic training program, and hopefully have just passed the exam. They would be part of the last group you just mentioned, writing, I believe, earlier in February for the final exam. And, our number one reason, of course, is to put confidence in our clients who are again, families facing cancer. I find there's been a shift that, patients are really healthcare consumers, and they're starting to ask questions and say, okay, how's this going to help me? Who is the best person to help me? This is what I want for my health, for myself. In our case, the outcomes I want following this cancer diagnosis. So to be able to say to them confidently that you have a healthcare professional that you know of with a nursing background, and they're also professionals in coaching. I think the other challenge and the reason we wanted to pursue this more formally is I think in Canada, there's a lot of question about, what is coaching? And I think that's why many of you had questions about how do you start your own practice? How do you market this? How do you get clients? Because I don't think it's clear to everyone in Canada anyway, that, the amazing benefits that come from working with a coach. So the more credit we can put to what we do, the better. And I think we were also looking to the future. We were wanting some broader learning in coaching. We've got very focused on cancer and know all about what a person goes through with cancer and what their needs are. And that's what we focus on. So now we want to step back for that 10,000 foot view and say, okay, health coaching, it has applications to other diseases. How do we know more about this? And how do we apply this to our current practice and service and make it better? So I think that's sort of, our main reasons. And I'll stop there in case people do have questions. And I'm happy to provide my information in the chat line as well if anybody wants to follow up through email. So thank you again, Tanya, for inviting me.
Thank you, Stephanie. And yes, please do provide your contact. I'm sure that there's many curious people out there on the line right now wondering about all the work at Ottawa Regional Cancer Foundation. And they've also done some incredible research around the use of their health coaching practice and outcomes to their clients. So the work was so successful that it resulted in the expansion, as I understand, of those services, which is really amazing. That is health coaching at its best, right in practice, if it can help expand the services and because the need is there. The need is there for those services. Yeah. So we're at time, and I'm cognizant of that time and getting everyone back to their day. I would like to thank our three guests today, Leanne Webster, Nicole Pope, and Stephanie Woodard, for joining us and giving us so much information about health coaching education and now the licensing. It's really deeply valuable, all of this information you've provided, and I know that probably people listening still have even more questions, and I thank you for doing all that follow-up work with many people who'll be reaching out to you. And just generally from Health Leadership and Learning Network, feel free to reach out to us. Let us know your burning questions. Odette has put up the contacts up on the screen right now. If you've completed our health coaching program, I think there's a few people on the line from a professional certificate. Congratulations. And for those who are still thinking about it, reach out to us. Continue to ask us questions. And with that, I want to say thank you to everyone for joining us. Stay safe and have a good rest of your day. And we'll see you, whether writing the exam, we'll see you or in our programs. And thank you. Take care, everyone.